Today, we're going to go ahead and get started. So I want to go ahead and welcome you all to our mass vaccination overview training. This training will be recorded. Just a couple of housekeeping notes if we can. So make sure to keep all of your lines muted. You can also make sure to take off or close your cameras off, or click on the three dots and not show your camera if you don't want it to be recorded. And then we will go ahead and get started. Make sure that as you're typing any questions that you're putting those in the chat box and not in the Q&A. So I repeat, do not use the Q&A. So we will be primarily using the chat box portion for this call. It looks like we have about a regular attendance so far this morning, but sometimes we have, several hundred folks, and it can be difficult to try and answer questions in both areas. So if you'll put everything in the chat box, that way we can make sure that we address those all in one place. So just to kind of go ahead and introduce ourselves a little bit to you. So the presenters this morning are going to be Marshall Vogt. Marshall is our COVID-19 vaccine operations section lead. He's not going to be live with us today, but he recorded kind of a basic overview back in January that's still, nearly completely relevant. And although there's been some, of course, updates to the Johnson & Johnson, which we'll get to in the end of the segment today. But we will be playing a recording for Marshall, going over kind of how the mRNA vaccines are structured and how we utilize those. And then also we're going to hear from Lean Abdelaziz. She's our COVID-19 MRC Medical Surge Coordination. And then myself, my name's Megan Doran. I'm our Virginia MRC COVID-19 coordinator. So this presentation, I saw a question in the chat box just now asking about how long it is. It's about an hour and 15 minutes. And we will be sure to give you the passphrase and everything towards the end of the presentation. So we will be sure to help you with all of those things. So with that being said, we'll go ahead and kind of go over what you're going to be learning today. So after today's session, you should understand a little bit more about state and local dispensing systems, also point of dispensing operations and their structures. And then we're also going to talk a bit specifically about the CDC COVID-19 vaccination distribution plan and Virginia's role in that. And then also we're going to talk about roles of volunteers in our medical countermeasures operations in Virginia. So with that being said, I'm going to pause right here and then I'll share my screen. So bear with me for just one moment and we will hear from Marshall. So Veronica, just to let you know, I'm having a little bit of issue. I'm clicking on advanced sharing options and it's not coming up for me.
Okay, you do have permission to share your screen.
Okay, it looks like it's finally working now. Thank you so much. My
Yeah.
apologies, everyone. A little bit of technical difficulties this morning on my side, probably user error.
Today, and thank you for letting me talk to you a little bit about what you are going to be helping to volunteer with, and we appreciate you helping to volunteer with this massive vaccination effort that Virginia is undertaking for COVID-19. My name is Marshall Vogt. I'm an epidemiologist with the Virginia Department of Health Division of Immunization, and I'm the operations lead for COVID-19 vaccination within the COVID-19 vaccination unit here at VDH. So we've been working very diligently over the past few months to plan for the arrival of vaccine in Virginia, as well as to plan how to get vaccine out to local health departments, to hospitals and healthcare systems, and to other providers, and to get that vaccine into people's arms. And again, you as MRC volunteers are critical components of our vaccination campaign. And so again, I thank you for all of the work that you're willing to do and all of the work that you will do as we take on this mammoth task. As you can imagine, vaccinating people is something that we do every day in public health, but to vaccinate so many people in such a short period of time poses a lot of logistical challenges. We know that there are several delivery methods that we can use for COVID-19 vaccine. And so we're trying to take advantage and continue to update our plans and revise our operational strategies here in Virginia to take advantage of those. And those are hospitals and healthcare systems, pharmacies, private providers, local health departments, and then mass vaccination clinics, sites where we could have a large number of people come while still respecting social distancing, of course, and receive a vaccine. And what's complicated about this is that it's a lot different from how we've done mass vaccination, say, for flu clinics or even during the H1N1 pandemic. One, we know that COVID cases are continuing to surge across the state, and so it makes it very difficult to deliver vaccine when we already have a very stressed healthcare system, and many of the people that would be delivering vaccine are healthcare providers that are helping to take care of COVID-19 patients. In addition, the two leading vaccine candidates that we have right now require 2 doses, and they can't be interchanged, which means that not only do we have to get people to come to us once for a vaccine, we have to get them to come back within the right period of time and get the same kind of vaccine product again. And of course, it's very difficult to get a large number of people together and administer a vaccine when we know that COVID spreads very easily, especially in closed environments where people are not able to socially distance from one another. There's lots of challenges for the COVID-19 vaccination program, but we know that it really is the key to ending the pandemic, and we're committed to working together to get vaccine to Virginians and people across the United States and across the world in order to stop this pandemic. You've probably heard about a couple of the vaccines that are being used for COVID-19 vaccination. Right now in Virginia, we're using 2 vaccines, one made by Pfizer and one made by Moderna. They're very similar vaccines in terms of their mechanism of action, but they differ a little bit in terms of their storage and handling and dosing and spacing. But they all use what's called mRNA technology. mRNA stands for messenger RNA, and it's something that basically tells our bodies how to make specific proteins. Think of it as almost a stack of copy paper in your body, and your body reads that and it prints out proteins based on what the mRNA says. We do this every day in our cells and our bodies, but the vaccine takes advantage of this technology by actually telling our bodies to produce certain proteins from the COVID-19 vaccine. So when you receive the COVID-19 vaccine, your cells receive a small piece of messenger RNA that codes for the spike protein on the outside of the COVID-19 virus. Our body's cells take in that RNA, and then they produce that protein and release it out into our bodies, where our immune system mounts an immune response to it. It works on the same principles as many other vaccines. It's just that our bodies produce the antigen, that protein that stimulates the immune response, internally instead of pre-prepared antigen being injected into us. These vaccines are safe and they are effective. They've gone through the same amount of rigorous research and clinical trials that all other vaccines go through. It's just we were manufacturing them at the same time so that once those research studies ended and we knew that the vaccines were safe and effective and they were authorized for use, they were already manufactured and ready to start being released, distributed, and administered. mRNA vaccines are not going to alter your DNA. And really the only adverse side effects that have been reported are symptoms that typically occur when your immune system is working and responding to something and trying to build an immune response. That might be fever and fatigue, sometimes achiness or soreness at the injection site, but these are very minimal symptoms. They don't last very long, and they're really a sign, again, that the vaccine is working. And more importantly, it's worth just a couple days of feeling fatigued or having a sore arm as opposed to taking the risk of getting COVID and becoming seriously ill. We know that these vaccines are the best way to beat the pandemic, and we're excited to start getting them out to people. Now, as I mentioned, there's a lot of people that need to receive vaccine, and we don't have tons and tons of vaccine yet because we're still manufacturing it. So we really had to think about how to prioritize who gets vaccine when and why they need to get vaccine. The federal government, Operation Warp Speed, the Advisory Committee for Immunization Practices at the CDC, they met and determined some phases and different criteria for people to be able to receive the vaccine. The phase 1A, or the very early vaccine recipients, include healthcare workers, those that are on the front lines of the COVID-19 fight, as well as those that live in long-term care facilities like assisted living facilities and nursing homes. That's because those individuals are very vulnerable to COVID-19 and poor health outcomes, including, unfortunately, death due to COVID-19. Phase 1A individuals have been receiving vaccine for the past couple weeks. And in fact, some individuals are already getting their second doses, meaning that they're fully immunized against COVID-19. And we're excited about that, but we know that there's more work to do. The next phase, or phase 1B, will include individuals that are 65 years and older, frontline essential workers, and those aged 16 to 64 with underlying medical conditions. That's because this next group really comprises a group that can be at risk, like those that are 65 plus or with underlying health conditions for adverse health outcomes due to COVID-19, or folks like essential workers that are constantly exposed to COVID-19 because they can't work from home or really practice social distancing. We're working right now to refine our plans because the phase 1B priority group was changed a little bit from what it was originally with the addition of people with underlying health conditions and the expansion of that age from 75 plus to 65 plus. As more vaccine becomes available, we're getting it out to more providers. Remember, initial vaccine really took place, or vaccination really took place at hospitals and local health departments. But now we're starting to see other healthcare providers being able to receive vaccine, as well as pharmacies receiving vaccine. And in fact, many of those pharmacies are the ones that went in and vaccinated people in these long-term care facilities. So as we get more vaccine out, and we're looking at those different avenues for vaccine administration, like pharmacies, like these mass vaccination sites, soon we'll be able to really ramp up the number of vaccinations that are being given here in Virginia. We've set a lofty goal of about 25,000 per day by early February, and we know that we want to scale up even more to about 50,000 vaccines per day. In order to do that, we're going to need more vaccines, more sites for people to go get a vaccine, and volunteers such as yourself to help augment our public health provider force in the community. Once we're well into phase 1B, we'll start to look at the next phase, which is 1C, other essential workers. Folks that keep our country working. They keep the lights on, they keep our infrastructure working, but they're able to maybe work from home or socially distance a little bit more, so there's less of a risk for them being exposed to COVID-19. Those folks are in the next phase, what I said was that 1C phase, and we're going to be turning our attention to them as soon as we're able to. After that, we'll start to open up the vaccine to others in the population who are interested in getting it. It's not going to be mandatory here in Virginia, nor is it likely that the vaccine will be mandated anywhere in the United States by the government. We need people to trust the vaccine, trust that it works, and feel safe that they're getting the vaccine and confident and that it's going to help end this pandemic. You are ambassadors as our MRC volunteers and can help answer questions and allay concerns. And we're excited that you're here to help us do that. Thank you so much again for volunteering and for learning so much about this vaccine so quickly and how we're going to administer it to folks in order to get out into the field and start vaccinating people. We appreciate your help, and we couldn't do it without you. Thanks so much. Be safe and be healthy.
All right, so that was a little bit from our colleague Marshall. So with that, I'm going to go ahead and now hand it over to Lean. She is our subject matter expert in all things point of dispensing. So go ahead, Lean, and you can take over from here.
Thank you, Megan. Good morning, everyone. Thank you for joining us this morning and taking time of your Saturday morning to join us. I'm going to give you a little bit of an overview about what we call it point of dispensing, POD. So you're going to hear the term POD throughout this presentation. My name is Lean, and I'm with the Virginia Department of Health, Office of Emergency Preparedness, and I'm the MRC Medical Surge Coordinator. Next. So what we're going to learn the next few slides, we're going to learn and understand what public health emergencies mean, and that require an actual POD activations. We're going to also describe the types, the purpose, and the functions of PODs. We're going to also talk about POD operation, the different groups, roles, and responsibilities. Next. All right, so what we mean by responding to a public health emergency? It's the ability to provide medical countermeasures, MCM, in support of treatment or prophylaxing to identify population according to the public health guidelines or recommendations, meaning that it's our ability fast to give countermeasures to the public or to identify population. With COVID-19 is a little bit different because the whole population is being exposed or might be exposed, so it's a little bit different. But it's a scenario that we're supposed to respond to as public health. Next. All right, so these some of the different dispensing scenarios that we normally see and we activate our pods. So for example, we have what we call it public health natural events, something like natural occurring diseases or novel or emergent infections such as COVID-19. Also any natural disaster that might have a risk to the population and they might need to get prophylaxis or any type of medication due to that natural disaster. That's also a dispensing scenario for us. But there's also scenarios where it's a man-made incidents, meaning somebody or bad people doing bad things that we have to be there to respond and be ready, such as bioterror attacks, small or large scale. These are letters that you guys probably remember back in 2001, 2002, the anthrax scenarios in the Washington, D.C. metro area and other government buildings. So this is also required us to be active and be ready to give prophylaxis medication to the public or to the people who's been identified that they've been exposed. Next. All right, so these are the top that require us to activate or plan for. So yes, some of these diseases might not be in the population right now, but we know that they might be done in the lab. So the bad people can go ahead and do it, and that's why we need to be ready and to respond to such kind of things like anthrax, plague, smallpox, and pandemic or emerging infections like COVID-19. Next. All right, so this is just a slide to show that the response time in general. Normally the incidents occur at the local level. Normally most incidents occur at the localities, and then the decision will make to dispense countermeasures. So I'm starting from left to right. So if you can see the incidents occurs there, the decision has been made. Probably a local health department director will contact the state health department, and then the state will contact the federal, meaning HHS, CDC, and ASPER, Assistant for Preparedness and Response. And then all the moving parts will happen. The logistic part will be rostering staff, will be rostering MRC volunteers. We start deploying kits to the actual where we're going to dispense the medication or the vaccine, and that will start checking in. People staff checking in, receive briefing, and then they transport them to the pod. We receive the medication from the federal to the state to localities, and then we open the pod. This operation normally takes about 48 hours. So 2 days mean from the time the decision is made until we open the pod. This is normally when we need to open it as soon as possible because we know the certain population has been exposed to certain disease. Next. So as I said, the initial action normally comes from the health director at the localities. So the health director, we call them, once they activate the pod, we call them the public health incident commander. He's probably in charge of everything that goes in this health district, in that jurisdiction. They normally initiate the unified command. They request support from any cooperating agencies around them, and after that, they determine the dispensing protocol. I'll show you guys there's different type of dispensing protocol. So it depends on the incident, it depends on the population, it depends how many point of dispensing that we need to open. That will determine the type of dispensing, and that also the health director will decide that. Or if it's a large incident, then the health commissioner at the state level will decide that. Next. So what's a pod? We've been saying pod. Pod is actually what we call it point of dispensing. It's a point that it's fixed, identified, normally in a public facility where medical countermeasure MCMs are given to the people to respond to a public health threat or emergency. So it's not a traditional place. It's a very untraditional place that we open and we ask people from the public to come in. As I said, sometimes it's identified population. It's a certain population, certain group that we know that they've been diagnosed, they've been exposed, and we ask them to come into pod. In COVID-19, it's a little bit different because everybody's been exposed and everybody is, if they want, willing and they wanted to take the vaccine, they're willing, they're welcome to come in. So the primary goal of pod is normally triage and Medicaid, and then there's also behavioral health and record keeping and informing the public as well. Next. So what's the difference between a pod and between a clinic? The clinics normally, if you go to a clinic, they go through your medical history. They ask for if you're your allergy. They make you fill out forms. So it's a process. It's a longer process, and it's normally individual focused. You go in as a one person. You have an issue. You deal with your primary care or your doctor, and then it's a little bit of time consuming too. And then if you need to be transferred or referred to a traditional healthcare setting, they normally send you to a hospital or a specialized clinic or whatever you need. And it's done in a traditional healthcare setting, meaning in a clinic, in a hospital, and it's normally by a medical professionals. The pod, on the other hand, is a little bit different. We don't do no exams. It's very limited records. So there's normally a form that people fill out. We ask them to come in. It's a population focus. We want to get people medication as many as we could, as fast as we could. And we process it very quick. And it's in a community-based non-traditional healthcare setting. It could be in a school, it could be in a gym, it could be in a parking lot. It could be in a church, so it could be so it's normally not traditional place. And if we give him pills, normally we don't require medical volunteers. If we're doing vaccine, it's a little bit different. There is some requirements there to have some medical professional medical license. Next. So as I said, there's two different type of pod dispensing protocols. We have what we call it non-medical model. For non-medical model, we normally give oral antibiotics, and there's no medical license required. And we normally dispense to the head of the household, meaning a person from the house, the head of household, can come in and say, I have 3 people in the house. We give them medication for those 3 people. That head of household can come in too and say, I have an elderly neighbor that they cannot come into the pod. Can I give it? They give their information, and we normally give it. In non-medical pod, we normally want to dispense as quick as possible the oral antibiotics, and we don't normally ask a lot of questions. For the medical pod, it's a little bit different, the medical model, because we normally give vaccines, so that person needs to be there to get their vaccine, and it's a medical license required. Megan will go over who can vaccinate in the next few slides after me. And then, as you can imagine, each member of the household needs to be there in the pod to come and get their vaccines. Next. So there's different roles and responsibility between localities, between the Virginia Department of Health at the state level. So at the state, we receive the proper medication or vaccines or whatsoever. We receive it, we unpack it, we store it in our secure warehouses, and then we secure it we normally have communication with state police and other localities, law enforcement localities, that they secure the medication or the vaccines. And after that, we distribute to the local jurisdictions and other state governments. At the state level, also We are responsible for public information and communication, meaning we probably have communication ready and risk communication materials for the public, for them to understand what's going on and how they can protect themselves and how they can be ready to receive medication or vaccine. At the locality, they receive where we send them, they secure, also working with local law enforcement, and their main responsibility is to dispense. So we look at it at this way: the office, central office, the VDH, responsible for distribution, locality responsible for dispensing. So the one they're dealing with the public directly, and they're dispensing the necessary MCM, the medical countermeasure, to the public in a timely and efficient manner. They're also responsible for public information and communication to the public. There's so many other roles and responsibilities, but I thought I'll just have these couple of roles just for you guys to understand how things go at the state and at the local level. Next. So there's a lot of pod operating policies. I thought I'll mention a few here. So non-medical pod, normally we don't require for ID. We just ask for full name, date of birth, phone numbers, and if they have any basic allergy information. For vaccine and medical pod, it's a little bit different. We ask for more information because we have a system and we have to enter those information into the system for people that they can come and get their second doses and if they have reaction or whatsoever. So it's a little bit different for a medical pod. Also, we have some media policy. We normally give access to the media to the pod, but at the same time, we're kind of limited because we don't want them to interrupt the operation. We want, it's a fast in and out. So media sometimes can come in and interrupt. So we ask them to step aside and we can answer questions. And we normally ask volunteers not to deal with the media. There's normally somebody at the pod a public information officer who can handle the media and give any public statement or any statement that the media is requiring or answer questions. So this is a question for you guys to get you thinking a little bit. Now you understand what pod is. So if you can maybe answer this question, what's the difference between a closed pod and an open pod? You can leave your answer in the chat box. Just make a random guess or
All right, so we're getting some different responses. It says closed is invitation only. And then let's see if anybody has any open. Open is advertised.
Yep, these are all correct answers. Thank you, Megan. So open, it's open to the public. Everybody can come in. We normally have it in a very in an open location, or people know about it. We advertise it. We make sure the public knows where to go. Closed pod is a little bit different. It's for identified population. What you see right now these days, this is what we call it a closed pod, meaning we open a pod for, let's say, health personnel, because we directed that pod to a certain population. Also, we have a pod for people who have 65 and older. So these are closed pod because it's only by appointment. You only coming in because you've been identified as this is your time to come in. An open pod, we're gonna have it. Everybody can come in. We're not gonna ask for appointment. We're not gonna ask people, to direct them to a certain place. Once they hear there's an open pod in a certain location close to their house, they're welcome to come in. And then the other thing, so here's the definition. I'm going to explain it a little bit more also. So closed or a private pod, we normally use the resources of partner organization to set up the pod and dispense MCM in their own facilities. Meaning, so beside the one that I already mentioned, where we call them closed pod, we also have what we call a closed pod. These are partners that we partner with them before even the emergency occur. So for example, we have already MOUs, we have some agreements with some of the big companies or government agencies. For example, all military bases in Virginia, we have agreements with them that once we receive a medication, if there's an emergency or vaccines, we're going to ship it to them directly. So their population do not have to come into an open pod. They can just vaccine their own people and their families as well. So it's not just the active or military, but also their families, they go there to get their vaccines. So this is one example. Also jails and correction facilities, we send them their medication, we send them their vaccines, and they can go ahead and vaccinate their own people, their staff and their inmates. Hospitals are as well. We have agreements with the hospitals. We send them the medication, the vaccines. They can go ahead and vaccinate their own people at the hospital. And this is what's been going on since I think mid-December to January, that we send that already to the hospitals. They've been doing that. A lot of other big companies as well. We can think of, for example, Dominion Power. We have an agreement with them. We can go there. We normally send them their vaccine, medication, and they take care of their own people. And that helped us a little bit with our open pod, because that we know that population is already been vaccinated and we don't need to deal with them, or we don't have to worry about them. So the open pod, as a lot of you mentioned, are open to everyone, no restriction, anybody can go in, and are located in the pre-identified community-based facilities that public health agency activate to serve the general public. Next. So these are example of pods. You can see the closed pod. I already kind of mentioned some of them, departments, jails, like for example, Department of Social Services, Department of whatever, any other department agencies, we also have contract with them. We have a contract with the Pentagon. They can come and get their own medication and vaccinate their own people. So there is a lot of different closed pod examples, hospitals, churches, and big companies, as I said. The open pod, you can see these are pictures from open pod. It's normally in a public school, sport arenas, gymnasium, community centers. We have what we call drive-through pod, and we have mass vaccination clinics as well. And then we have the pharmacies. We have agreements with some of the pharmacies, local pharmacies and big chain pharmacies, that they can help us vaccinate as well, or even pass medications. So the pod operations, the primary goals, as I said, triage, medicate, and educate. We don't treat people. So if somebody come in sick with corona or any type of disease, we normally direct them to the right place to go. We don't allow anybody who's sick to come into pods. We greet and screen them. We give them the form to fill out, and then we dispense the medication or vaccinate. Next. So I'm going to go over different roles that you guys might play, just to give you an idea. Just keep in mind that pod from a pod is different. A pod could have 500 people that day. So the operation will be a little bit different from a pod that they're going to receive 1,000 or 2,000 a day. So, and the names of the roles changes as well from pod to pod, but just to give you an idea and overall. So the command staff is normally at the top. They manage, they coordinate, they conduct, the consultant overall MCM pod side, including operation, liaisoning, public information, security, safety, planning, logistic, and administration. So they're normally responsible for everything. They're in the top, they're leading the whole pod operation. They report to either the emergency planner at the local health department or the health director directly. Next. So these are some of the responsibility for the command staff. As I said, they direct all dispensing operation. They coordinate with different partner agencies at the pod side, meaning, for example, we open a pod at the school. They need to contact the administrator of the school, let them know that we're activating the pod. And those agreements, by the way, and those talk, it's ahead. It's been done ahead of. They're not going to just call last minute and be like, hey, open your school, we have in a pod. No, we already have these plans. We already trained with the staff at the school. They know the procedures, how we're going to come in, how we're going to set up the pod. So these plans we've been developing those plans for years. They communicate also with the health HDOC, which means the Health District Operations Center, or the Emergency Operations Center at the state level. They make sure that they're resourced there for the staff. They manage any small incident within the pod, and they ensure the safety of our pod staff and clients. Safety is number one during a pod operation. We want to make sure people are safe who are coming in, and also the staff and volunteers are safe as well. Next. So we have what we call it the safety officer. Sometimes they call them biosafety officer. That person, he or she, or that team will monitor the clinic operation and advise the clinic point of dispensing supervisor in all matters relating to safety. That can include the health and safety of the clinical personnel and clients, the volunteers, and also they access and anticipate any hazard and safe situation within the pod. So if there's a place that where people can fail or whatever it is, so they kind of just monitor and look for any hazards that can create unsafe condition or unsafe situation to the people working in the pod or people coming into the pod. And that person normally report to a pod manager or a clinical supervisor. Next. Next. Thank you. So we go into the unit leaders and supervisors, and some of you might play that role of, directing a team or leading a team. They make sure they're responsible for the safety and welfare of their staff. They oversee the operation of that particular unit or that particular team. They give briefing and update to their staff. They also ensure the staff have adequate breaks. They take enough rest. They look for any PPP exhaustion. And they ensure the time records appropriate for the staff and volunteers as well. So here, an example of a POD ICS structure. As I said, those structure can change. It depends on the pod size. So you can see on the top, there's the pod manager. These are the command staff. The safety officer are part of the command staff. Sometimes it could be a one safety officer, sometimes could be a one safety officer and biosafety officer. Two people will be there, sometimes three, sometimes four. As I said, it depends on the pod operation. There is normally also on the left side, there is the public information officer. That person is responsible for the media, for any answer any questions to if there is a media outlet out there or anybody's asking a question. You can see all the team leads in red. Support services, these are the different teams lead, and then different teams will be under those unit leaders or team leads. Next. So COVID Vaccinator, it's a straightforward description. They prepare and administrate the vaccine to clients. And that person normally report to a pod manager, a unit leader, if they have a unit, or a clinical supervisor. So a vaccinator support or a medical evaluator, sometimes could be one person doing both positions, and that could be two people doing medical evaluator, two people doing the vaccine support, 10 people doing the vaccine support. We have only medical evaluators. It depends on the size of the pod. Those people, they ensure the clients receive the proper screening and medical evaluation pre-protocols. They collect and process all patient registration and evaluation forms. They record the time in and out. And that person also report to the pod manager. Sometimes they might be reporting to the unit leader or a clinical supervisor. So this is just to have a visual where exactly that team's sitting. They're sitting there in the clinical supervisor or unit leader, and they have the vaccinator, they have the vaccinator assistant, they have medical evaluator. So it depends on the size of the pod. This is a question for you guys. Can you think of any support roles or role to a pod mission beside the one that I already mentioned? You can put your answer in the chat. So can you think of any role that might be supporting?
Looks like crowd control, greeting patient safety, logistics, flow, data and clerical management, logistics, EMS, recovery, greeter, food.
Yeah. Food is important. Yeah, these are all correct answers. We need, in order to run a pod like this, we don't need just medical volunteers. We don't need just vaccinator. We need everybody to be there, different roles to support. So yes, we have traffic control, we have greeter, we have somebody who's taking care of the media, somebody who's taking care of the food, the logistic, the traffic flow there. If it's a pod outside in the parking lot, they need to make sure the safety of people going coming in and out, directing the traffic. So yes, there's so many roles that you can, and security as well. We normally have localities, local law enforcement to secure pods. So if it's in a Fairfax County, we normally, Fairfax County Police will be there, Alexandria, whatsoever. So normally we work with locality, local law enforcement to have present. We also work with EMS to have a present as well, especially if it's a big pod. And just anticipating anything, we normally have an ambulance sitting outside if they have the time and they have the resources to help us. All right, so logistic support, as some of you mentioned, logistic logistic is very, very important part of the pod operation. They organize, they direct, coordinate the operations associated with occurring and maintaining the facility, personnel, equipment, and they support the point of dispensing functions overall. That person normally report to a unit leader, a logistic supervisor, or a pod manager. Or it could be just one person doing logistic. They don't have any they don't have a unit leader or a supervisor. They report directly to the pod manager. All right, so you can see where the logistic are sitting. Sometimes in the logistic, there'll be a runner, there could be an IT person, there could be somebody who's handling food, could be somebody who's, so it depends on the size of the pod and the needs of that pod. Next. So the admin, vaccine controller, fillers, screeners, assistant floaters, these are all under admin support. They review, screen the form, they assist vaccinators with preparing the appropriate type of vaccines. And those people, they normally either report to a pod manager directly if it's a small pod. If they're under support services, they're doing some type of support. If they're under the flow or traffic unit leader, if they're the admin, sometimes could be an admin unit leader. So just it depends. Just for you guys, just to get an idea. But as I said, names can change between pod to pod, but the roles and responsibility are very similar. So the greeter, screener, some of you mentioned that. They greet clients at the door. This picture is a real picture from one of our point of dispensing. They make sure to take the temperature, make sure symptoms, people are not sick, direct anybody who's visually sick to the appropriate place, and they assist, address any such needs, any such like physical or language services or people with disability, any type of needs that they feel that person might need to make their experience smoother and easier. We'll make sure to address those needs. Next. So the form distribution or reviewing unit, they're the one who actually give the forms to clients, let them fill out, answer any questions. They review the form, they record the time in and out, and they monitor also the clients. They see if anybody who needs any language assistance or interpretation or any type of help to make sure that they fill out the correct form in the right way, correct. Next. The flow, as some of you mentioned, the flow traffic control unit, sometimes if it's an outside a clinic or a traffic, or I'm sorry, drive-through clinic, they're normally there to direct traffic, even inside, because we want the operation to run smooth, so people coming in and out quick. So those people would direct and the flow of the pod. And they also address any needs if they see a needs of any clients. You can see here in the ICS structure. ICS stands for Incident Command Structure. So here you can see them under the flow control supervisor. You can see some of the critical supervisors. So just it depends size of the pod. Next. Interpretation and special accommodation, that person or that that team would be responsible to assist non-English speaking clients to understand the information and process it through the pod. They interpret the information between pod and clients, between pod staff and clients. They also identify any accommodation or needs to vulnerable populations such as children, elder, absence of function needs, hearing and visual impairment. So any needs that we feel like we try our best to identify and accommodate. That person will be reporting to the support service unit leader or directly to a pod manager. You can see where they sit. They sit under support services. That support service unit leader might not be there. They might just report directly to the pod manager. Next. So now we're into the pod demobilization. What do we mean by that? The pod is ended for any reason, either the vaccine, we finish all the vaccine that we have, or the operation is ended. We decide it's going to be a 4 hours operation. We decide it's going to be 6. We decide it's going to be 12 hour. That operation is ended. We need to demobilize, or something happened, unsafe situation happened, and the pod manager decided to end the operation. This is when we mean by pod demobilization. So at the conclusion of the pod operation, each pod manager will make sure to secure the MCM inventory. SNS is the Strategic National Stockpile. Sometimes we get the medication directly from manufacturer, like with the COVID vaccine. Sometimes we get it from what we call it the Strategic National Stockpile. It's a stockpile within the federal government. They have a stockpile of medication and medical supplies that we can request. So here, that's what we mean by SNS. So secure SNS, MCM inventory, and they notify the team leaders that this is time to demobilize the pod. At that time, the team leaders will hold a debriefing, a hot wash. What we mean by a hot wash, they normally have their group together. They talk about all the different things. They discuss the success and the areas of improvement. So we normally learn from each pod. If it's something went well, we like to duplicate that and continue do the good things. And if something went wrong, we want to learn about it and make sure to improve it the next time we open the pod. And the general pod staff would then assist a pod facility staff in demobilizing or setting a pod for follow-on pods. What we mean by that, normally an operation ends by this time, next pod operation will start next day or whatever. So we need to make sure the pod is ready when they open the next day. Next. So here I'm gonna leave it, there's some tips and training. I'm gonna leave it to Megan to take it from here. But we'll take some questions if you guys have any questions.
All right, thank you so much, Lean. And I see one question in the chat for what does SNS stand for? If you want to address that one, Lean.
I already said it, but it's the Strategic National Stockpile. So the Strategic National Stockpile is under HHS, the Department of Health and Human Services. It's managed by ASPR, which is the Assistant for Preparedness and Response. There is a stockpile of medication and a lot of different beds and different things that the medical community needs or public health needs when there is an emergency. So that's those stockpiles are placed throughout the countries in location that is easy to get in to the people who needs it. So, for example, if there is an incident here in Washington, D.C., we normally receive that stockpile through either Dulles Airport or through the Richmond National Airport, or sometimes it can come with the train. So it depends, where and what we need. They can send it to us as fast as possible. It takes about 6 to 8 hours to get when we request it from the federal government. MCM, it's medical countermeasures. Anything that we do to protect the public, we call it MCM if it's a vaccine or medication. Here, MCM is normally for people who are exposed, not sick. So if you're already somebody who has a COVID-19, a person who's already exempt the symptoms, we don't call that MCM, that's a treatment. MCM, we give it to the people who we think they might be exposed, but they haven't been getting sick yet. I don't know if there's any other question.
Perfect. So Josh asked one additional question about, where to find the list of different trainings needed to become a vaccinator. We're going to be going over that pretty soon. So hang tight for just a moment and bear with us, and we'll make sure to cover that in just a moment. But thank you so much, Lean.
Thank you, Megan. I'll be here for any other questions.
Awesome. All right, next slide, please. All right, so going over kind of a couple of tips for participating in a pod. As Lean was mentioning, we want to make sure that everybody's being proactive and working together to support the pod. There are lots of different roles, so be sure to be proactive, pay attention to the staff members' needs that are both yours and around you. And then also making sure to be transparent. If you don't know something, making sure to be clear that you aren't aware of that. And the way that as Lean has shown that pod is structured, there should be someone that is in charge of each particular role that's being addressed within a pod. So that person will be the one to support or find out information for you if you need that. And then don't be afraid to get your hands dirty. There's a lot that goes on, and being kind of proactive and involved can really be helpful. We want to make sure that that everybody is supporting both the public and the operations that are being done each day at pods. And especially right now, we have lots and lots of pods all over the state. So we so appreciate your help. Next slide, please. And then, of course, safety is, of course, the utmost importance here. And we suggest that, safe pods are successful ones, right? So we want to make sure that you guys understand that it's everyone's responsibility in a pod to monitor for safety. So that can mean from a vaccinator standpoint or someone who's monitoring patients after they've received their vaccination. That can be kind of watching patients, making sure that they don't have an adverse reaction. But it could also be somebody, say in the parking lot, who's making sure that everybody has a way to flow in appropriately, or say a greeter at the front door who notices like a small thing that could be a big thing, where a mat gets kind of pulled up on the floor and it becomes a tripping and falling hazard for our elderly patients. So, making sure that we're kind of reviewing everything through that lens of safety. Next slide, please. So some safety considerations just to mention is to make sure to dial 911 if there are no emergency members present from EMS, etc. We, of course, have many people on site for our current pod setup that are able to do CPR and first aid, etc. So making sure that if you don't have someone in your immediate area, that you do call 911, however. Also make sure to inform your supervisor, your incident command supervisor, or your safety officer of any kind of safety issues that you identify. So making sure that if you see those, kind of moderate or minimal things, that you're making sure someone's aware of them so that we can address them. And then also making sure that you are taking your role seriously and that you're watching for things like PPE exhaustion. We want to make sure that everyone stays safe throughout the pod, and that includes us as well. And then if you see something, making sure to say something. Usually towards the end or after a pod, there will be what we call a hot wash, where we review, what was good, what was bad, and what we need to change for the next time. I see a question really quickly about provision of PPE. And what PPE exhaustion is. So PPE exhaustion, what I'm referring to there is if we're running out of something. So let's say we're running out of gloves, we're running out of masks. If you're working with the public close by as a vaccinator, we do provide PPE for our vaccinators, people who are working, through the greeter roles who may be partitioned away from the public. We just ask, of course, that you wear a mask. It can be a cloth mask, etc. So next slide, please.
I want to just interrupt a little bit. So PPE exhaustion means also if sometimes people get exhausted from wearing a mask for a long time, or wearing a big suit of the, PPE, different PPE. So it's normally if you see somebody who's not breathing or getting sweating or whatever, that's what we call it by signs and symptoms of PPE exhaustion.
Yes, exactly. Thank you so much, Lena. I appreciate that clarity. All right, so now we'll get a little bit more into the specifics of COVID-19 vaccinations. All right, so as you guys are, I'm sure, very well aware based on the media coverage, et cetera, plans are underway both at the federal and the state levels for mass vaccination for COVID-19. We're, of course, in the finalization periods for certain specifics for things like the Johnson & Johnson vaccine, which we'll talk about in just a moment, and should know more about that soon. And then we will be using a variety of different pod models, as Lean kind of talked about earlier. So you may be working at a drive-up pod, you may be working at a walk-up pod, and a host of different ways of designs based on the community needs, the community structure, and how best we can kind of identify and help those groups that are trying to get their COVID-19 vaccine. So the Medical Reserve Corps has served and will continue to serve a very critical role in the vaccine administration and distribution efforts. In some cases, we have some of our pods that are set up with nearly 100% of Medical Reserve Corps members. So making sure that you're trained and that you're, look and taking this very seriously is really important. All right, next slide, please. So just a little bit of more of vaccine information. So as you guys can see, there's been a little bit of change on that status column, but I do like to keep this slide just because of some of the storage and administration information that's on here. So as Marshall mentioned in the video prior, we are currently giving the Pfizer and the Moderna vaccinations. Those are both mRNA type of vaccines, which Marshall described previously. The Pfizer is stored typically in deep freeze storage. I have been reading that there's been some new developments that may change how that's stored, but as of right now, this is how we're storing it based on the manufacturing guidelines. So Pfizer is deeper freeze than Moderna, and Moderna can be a little bit more shelf stable for up to 30 days, where Pfizer is 5 days currently. In terms of the administration, it's a little bit different for each of these two. So they're both 2-dose vaccinations, with the Pfizer being 21 days apart as recommended, and the Moderna one being 28 days apart. Now, that doesn't mean that you can't get it on day 29 and beyond, or 22 and beyond, if we're talking about Pfizer. But, that is how it was studied and how it was recommended. So as for the Johnson & Johnson vaccine, they applied for EUA approval on the 4th, and we should be hearing back soon next week regarding their review of EUA approval by the FDA. So more to come on that. So this is a little bit older of a chart. As Marshall mentioned before, the phase 1 and phase 1A, phase 1B categories changed slightly. This was back from September when this CDC kind of scale up was last drawn. So it has changed a little bit, but the real takeaway here is I just want to get your feel for this kind of line graph that we're looking at of how we're moving from between phases 1, phase 2, and ultimately on into phase 3, probably beyond this year. So phase 1 is really where we're at now, as you can see, and we're really in that kind of ramp up phase. So I like to think of this a little bit kind of like a roller coaster, and we're trying to click around on the tracks and get to the top of the hill, so to speak. So we are still in that red oval area where we are working to move between phase 1A groups and phase 1B groups. And if we move to the next slide, you can kind of see where Virginia is. So this was taken off about a week ago, and you can see that in phase 1A, we primarily focused on healthcare professionals and residents and personnel in long-term care facilities. And we have completed a lot of that. It's not completely complete. So there are still people that are coming in that maybe wanted to wait, that were in that phase 1A category, et cetera. But we did complete enough that we felt capable to move on to that next phase 1B category. And that phase 1B category is what we're really currently in and focusing on a lot right now. Those are people who are essential workers, people over the age of 65, people with underlying medical conditions from 16 to 64, and then also people who are living in congregate care facilities or correctional facilities, homeless shelters, migrant labor camps, etc., anywhere that has a lot of people that are living close by one another in that kind of congregate setting. So we are hopefully going to be moving into phase 1C very soon. We don't have a definite timeline on that because it is based a lot on the amount of vaccine that we're receiving, both at the state and local level. and then also how we're able to administer and dispense that out to the public. We want to, of course, make sure that those that are in those kind of most critical and risk areas are being addressed first. So as we move to the next slide, please. So some frequently asked questions that we have. The first one is, our MRC or Medical Reserve Corps volunteers who are actively supporting the pods, are they considered to be in phase 1A? The answer is yes. So people who are supporting these these COVID-19 vaccination pods and that are working closely with the public are considered to be healthcare workers. And so you may be offered the COVID vaccination if you're working on site at a pod. Now, I will say that that is determined based on your local health district's needs. So overall, I can say that you are considered in that phase 1A, but when you're signing up for a pod, realize that a lot of times the vaccination will be given after the pod to make sure that our workers don't have an adverse reaction or have any kind of issue when they're receiving the vaccine. And then sometimes there may be a limited amount depending on the area of the state, especially as we're, trying to address both secondary shots and still primary shots for a lot of different groups. So be sure to check with your MRC unit leader once you're responding to being able to help with an activation alert for a pod, and they can give you some more information about that. If we can back up one moment. Thank you so much. So if you need more information just about those phase 1 priority groups, you can certainly go to this link that's at the bottom of the page. It's our COVID-19 vaccine page for VDH. And then we can go to the next slide. Thank you. So we do have a public option to look at the Virginia state plan for how to vaccinate. So you're welcome to go to the COVID-19 vaccine. It's on the same page as the other, but there's specifically a resource tab that you can click on to review a copy of the state vaccination plan, And you can read a little bit more about how we're distributing and how we've decided how to do all of those different steps. So our pod locations, as Lean mentioned before, a common question is, are they already determined? As she mentioned previously, they are already determined. We do a lot of research based on where pods are, how we would be getting in touch with those community members that are at most risk and at most need. So there is a lot of effort that's put into that. They're not necessarily always public though. So a lot of times we have pod locations that, especially right now as they're invitation only, that are kept private until the actual date of the pod. As we get more vaccine and as we move into that 1C category and into that phase 2 especially, we should be opening up more open pods, so more publicly administered pods, and then hopefully the distribution will also go out to places like CVS and Walgreens and kind of your local pharmacies as well. Next slide, please. So another common question that we have is kind of how is data entered into our Virginia VIS system? So we are kind of in the works right now with kind of switching over systems. I know that there's been a lot of media coverage about the way that shots have been entered into the data system. And Virginia is really in that top 10 to 15 states who have been able to administer quite a lot of shots, quite a lot of the percentage of shots. There was some data issues earlier in the year, earlier back in January, that we have resolved. Our current primary system is we utilize VAMS, but we are migrating over to a system called PrepMod. Both of those systems directly enter information into the VIS system. And so that, that immunization information does translate over to that into that national registry. So, and then also another question that we receive a lot is how long after the immunization is it before an immune response really takes place? As many of you who may be medical already know, as soon as you receive an immunization, your body starts creating an immune response, but it can take a little while, right? So after about a week or so, you should have a certain level of immunity to the first vaccination, and about 1 to 2 weeks after the second vaccination, either with Pfizer or Moderna, based on when those are given, you should have kind of that full immunity to the virus, as much as the efficacy will allow. So 94, 95% roughly. Next slide, please. So now who can vaccinate? Now I want to just make sure that I'm clear here that this slide has changed, but we are still awaiting some guidance from our Department of Health Professionals portion of the state for the exact language. So I could not add it here for today's session, but this has expanded greatly. So as of right now, these are the groups: MD, DOs, PAs, NPs, RNs, LPNs, pharmacists, farm techs, and farm interns under the purview of under the supervision of a pharmacist. So these are the groups that were currently allowed to vaccinate. With the passage and signage of House Bill 2333, this has grown substantially. So that being said, we will be sure to message out who all can vaccinate and how and what all type of training is necessary based on that. We will soon provide that to everyone, probably within the next few days. But like I said, we're still awaiting some guidance from DHP, or the Department of Health Professions, for who can vaccinate and under what provisions. So as we await for that, I can't message it out clearly right now, but I can say that if you would like to look over that bill and see who all may be, whether or not you may be able to vaccinate, you likely probably would be able to if you have a license in the state of Virginia. And then also the PrEP Act has made it to where more people from out of state can also vaccinate as well now. So if you have questions, we'll get to how you can ask those towards the end of the slides in just a moment, but just do know that this has been expanded, but we're still awaiting some guidance. So next slide, please. All right, so here are some recommended trainings. These are not required, but this POD Essential Overview training can be helpful to understand some of those more detailed, portions that Lean was going over about who is involved in what part of the incident command, pod system. So feel free to take this training. It's on Train and it's about an hour and a half. But again, it's not required. It just may be useful for you if you're interested in learning more. So for our questions today, again, you're welcome to email us any questions that you receive. My apologies that the email address is cut off here. That should say vamrc@vdh.virginia.gov. And then that original question, or that original email up at the top, is for COVID-19 specific questions. So you're welcome to ask those at both of those. If you have any general questions, say you're having trouble with your profile or you're needing some information, just general, you can use that vamrc@vdh.virginia.gov. So with that, I want to say thank you first and foremost. We will take some questions now. So I'm going to pause for just a moment and see what questions we have in the chat. Lean, if you have any ready.
Sure, there's one an MD who's retired. He's asking if they can vaccinate or they could be considered as vaccinator.
Yes, so it really depends on when you retired, but more than likely, based on the House Bill 2333, you can be a vaccinator if retired. That bill makes it to where if you've retired and had an uninhibited license for the years prior to your retirement, that you can vaccinate up to 20 years from your retirement or when your license lapsed. So we will be sure to make sure to allow for that.
There was a question about a mask, and I can answer that on the chat. So during for pod operation, the requirements by CDC guidelines to wear just a regular surgical mask, because we consider people are not sick coming to the pod. So it's a little bit less PPE requirements than working with actual people who might be exposed or have
Right.
COVID-19. So surgical mask is all you
Right,
need.
because for what we're doing in a pod, we are within close proximity if you're a vaccinator. So we do request, or we do have you wear a surgical mask, but you're not in an aspiratory role where you would be aspirating someone with that swab. So for example, at our testing locations, we require folks to wear an N95 respirator that's been fitted, because they are potentially, aspirating the virus. So in the vaccine role, however, you are closer in that role, but we just require, based on CDC guidance, that you wear a surgical mask.
All right. There was a question also. She's 65 years old, have underlying condition. Can they get their shot? And I think you kind of went over that MRC volunteers can get their shot. But if you want to provide more, Megan.
Yeah. So I want to be clear that if you find that you're in a category that's maybe a higher risk or something like that, you can have a couple of options. So if you're willing to support a pod where you may get a vaccine either after, at the end of the pod, or, prior to your second pod or something of that nature, you're welcome to do that. If you find that you're in a category, though, that you're concerned that that may be an issue for your health, we encourage you to wait until your time has come to receive your vaccine. This is going to be a very long effort. We expect to be serving the community with this effort for several months, possibly longer than that. I can't say that for definitive, but my guess is that we're going to be doing this for quite a long time. So we want you to serve, but we want you to be able to serve safely. So feel free to wait. You can certainly go ahead and do training and things like that. But if you feel more comfortable waiting, we so encourage you to do that until you can perform tasks with that kind of more certainty that's needed, because your health is very important to us too.
Thank you, Megan. There's a question about VEST, the system that we use for vaccine. And there was just, I think, a comment, or they're wondering if that system is only a Virginia system. And I think the answer is right. Yeah.
Yes, it's VIS is the Virginia system. I'm sorry, I should have clarified that it connects to kind of our overall registry. The CDC can pull information from that to see how many people have been vaccinated and where in terms of population health. So that's what I was talking about in terms of national. So thank you for clarifying.
Somebody's asking Megan, they said you removed the psychological first aid train ID from your slide, different than the slide deck online. Is there a reason that has been removed, or there's no longer such?
We're actually working to update that, and I had included it and then was made aware that they are working to update that. So once we have that, we will be sure to share it. Adrenia, feel free to put any information in the chat if you can about that PFA course or when it may be available. My understanding is I believe it will be available again at the end of March, early April.
Thank you, Megan. Sharon is asking, she's a current RN, and does she still need the training for a vaccinator? To be a vaccinator?
Yes, so because we are working with an emergency use authorized drug, we do require that everyone is trained on that. Now, if you're currently in a vaccinating role, say like you mentioned an RN, you're working in clinic or in maybe a hospital setting, and you give vaccinations on a fairly routine basis, you're probably going to have a lot less training to do than say if you've been out of the workforce for say 10 years and haven't done recent training on things like airborne pathogens, bloodborne pathogens, etc. We do have a training that I believe Lean shared in the chat previously, but we can also share it again in just a moment. It does have a limited amount of training. We've worked very hard to streamline that, primarily to just make it so that we're focusing really on those specific differences for what this this vaccine may look like or does look like. So we're focusing on, making sure that you understand how to use an EpiPen, and then also specific, requirements for how to handle that vaccine. For example, Moderna is not to be shaken. So, there are different needs for these vaccines based on the fact that they're very new to us. So we want to make sure that everyone is equitably trained in that so that we're handling those vaccines well and administering them well to the public.
Megan, since you're talking about training as well, so somebody's asking, there's any other required trainings to become deployable, or just orientation will be enough?
So in order to be deployable as a general support kind of person in a pod, so doing some of these non-medical roles, the main thing is for you to have your orientation and to make sure that all of your background investigation and everything that we need in your profile has been complete. If you are going to be vaccinating in a medical role, again, we will put that information in the chat, but there is that additional training to be able to deal with that. If you're going to be working in a role where you're handling vaccine, so for example, if you're going to be doing any kind of cold storage, transfer, etc., there are also training modules for that. And so that's all on that same page.
And if, just to add to Megan, if you reach out, if you're interested in a particular role, you can reach out to your local unit coordinators, and they'll be able to let you know direct you to what type of training that you might need extra, if any. There's also a question about where they can send their credentials to be vaccinators, so if they already have the credentials. That's probably a question about training, Megan, right? Or their account at VHAS, right?
Yeah, so if you maybe can restate that, I didn't quite follow.
Or it's a question where they can upload their certificates, or the different,
Yeah, so in your VVH profile, that's going to be where you put all of that information. So it'll have a credentials tab at the top of your kind of screen, and that'll be where you can put all of that information. If you're waiting for your background investigation or anything like that, just make sure that you've uploaded things like a driver's license and that you have a picture that is, with a blank background and you aren't wearing sunglasses or anything like that that may keep you from moving forward into that background investigation portion.
Some people, they're asking about the phrase that they need to put, because some of them might need to drop off. So maybe Adrena can, or you can share that slide again.
We can go next. Yeah, perfect. So you can go to this website here and click there, and then it's going to ask for that secret or private phrase, and it's pod rocks. So you don't have to do not put that in the chat. It won't get it done today. But if you want to make sure to go to this website and put that secret phrase into that website.
Okay, there is a question about EMT. pre-medics. They thought that they might be they can vaccine as well. They can become a vaccinator. So that's the question. It's an
Yes,
EMT.
so again, under that House Bill 2333, they certainly can. There are specific regulations though. So again, we're waiting for Department of Health Professions guidance on that and from the governor's office specifically. So once we have that, we're gonna just make sure that we have all of that lined up so that we can make sure that we're messaging that out pretty clearly.
Megan, there's a question about roles assigned to volunteers. As we mentioned, it's based on your background, your interest, and you can always reach out to your unit coordinator and ask them, hey, I want to be a greeter. What type of training do I need to take next, or am I done? And once they see your profile as well, they will assign you to roles. So you might get an email or an alert saying, okay, you've been assigned to be a floater, you've been assigned to be a vaccinator, you've been assigned to be a medical evaluator. So they're going to look at your profile once you're done with all the things that Megan mentioned early, and they will assign you roles. But if you want to play another role, you can always reach out and be like, hey, can I play also that role? Because I think that I'm interested in, or I have the capacity and the background that I can help in that role. And don't be shy if you want to have even a leading role, if you want to be a unit leader, if you want to be a supervisor, if you feel like that's something you've done before and you're comfortable leading a team, you can always ask for, for whatever particular role that you're interested in. Let me see if there's another question. Okay, the question is, how do I know who's my MRC unit coordinator?
So we have a link for that. First off, I'm going to share a link for the Vaccinator training information. So I'm putting that into the chat right now. And then I can also put that, that coordinator information. Give me just one moment. We're multitasking today.
Let me see if there's another question that I can answer while you do that. Can my 16-year-old daughter can volunteer?
So in most cases, I would say that most of our units require 18 years and over to volunteer right now, especially due to COVID and all of that. You may want to still contact your individual unit. I know that there are occasionally some units that will allow 16-year-olds and up to vaccinate, or I'm sorry, not to vaccinate, but to volunteer is what I meant to say. So use that link that I just posted in the chat. You can contact your MRC coordinator and find out more specifics about that. But I would say as a general rule, we require you to be 18 years and older.
And if somebody's receiving alerts already, does that mean that their background check came back or they're ready to be deployed?
Usually that means that you have been approved, or that they've put you into a status so that you can go ahead and begin doing your training. If you're not sure, you can contact us at that VA MRC at vdh.virginia.gov website or email, and we can definitely check into that for you to just make sure. But if you're receiving alerts in general, you should be ready to go, but you may just want to double check, especially if you're still needing to do any vaccinator training. And I should say, for vaccinator training, we do require a skills checkoff too. A lot of the times we do those skills checkoffs at the beginning of the pod before we see any individual patients. So they may have you come in for your first pod and do that skills checkoff at that point. But just to make sure everybody realizes that we do that as well.
And Adrina also answered that question. She said, if you look at your profile and you can see that the BI has been completed, and if you've been moved to level 3, that's mean your background and investigation has been completed and you're ready to go. So
Right.
that's another
Excellent
indicator.
point.
Yeah, you can see it. Yeah. And there was a question also, if somebody wants to be fit tested, you can get fit tested through your health department. Reach out to your unit coordinator. They can also let you know when to come in to get fit tested if that's something that you want to do.
Yep. And we also have a place to put that information in your profile too, to make sure that, if you're fit tested for a certain type of mask, that what that mask is for the future.
Megan, there was a question also about the 1.5-hour training. I think they're talking about the pod training, essential pod training.
Yeah, if everybody's okay, we can kind of back up a slide or two to that.
Thank you.
Oops. Well, we can certainly put that information in the chat. So, oh, perfect. Thank you so much, Adrenia. Adrenia is doing so much for us today. She's entering information in the chat and managing our slides. So we really appreciate her help.
So somebody's asking, what's the next step after completing the new volunteer training and the vaccination training?
So the next step after this is to make sure that you're deployable. And then like I believe Rhiannon mentioned, making sure that you've done the vaccine training, then you'll be, brought in to do your skills assessment, either prior to the pod or on the day of the pod before it opens, and verified probably by a public health nurse or possibly even an MRC that's been signed off as a skills evaluator. So they'll make sure that you understand everything about how to handle and give the vaccine, make sure you feel comfortable in your environment and everything, and then sign you off so that you can begin vaccinating. And then you will receive alerts that you can reply to.
Yep. And those alerts, it can explain to you where's the pod and how many hours and what type of skill is needed. So once you open the alert, you can sign to, or you can say I'm not available. So you will have enough information on those alerts once you're ready to be deployable. There's a question also about retired licensed pharmacists. She's asking if she can vaccinate, and I think you might kind of went over that a little bit.
Yeah, so those should all still be able to vaccinate according to that new legislation. But again, we will be messaging out to everyone, probably send a statewide alert even in the next few days once we hear specifics from our Department of Health Professions, because we just want to make sure that we're not confusing everybody and that we're being very clear with that information. So you will be able to vaccinate, but we want to make sure that we're clear for how.
And then there is a question, will there be weekend evening events that they can volunteer to?
Yeah, so pod events take place all types and times. As a member of the MRC, we invite you to participate whenever you can, but there is no requirement for a certain amount of hours or anything like that. So just be out, kind of keep an eye out for their alerts as they come into your text messages and your inbox and your email, so that you can kind of see what works best for your schedule. Because I know a lot of us are working and it may not be possible for you to commit to a full day, in the middle of the week, but maybe you could do a weekend or an evening or something like that. Just be sure to follow up with your coordinator and then to monitor for your alerts.
And then we're going to provide the link again, probably, or that slide that shows where they can go and show their attendance for today. There was also a question about the level of different MRC. So if you in level 4, that's mean they're still doing your background checks. Once you move to level 3, that's mean you're ready, your background is ready. And then the different type of medical professionals, they have different levels as well. Level 1, normally they work in a hospital, in a healthcare setting. Level 2, they're medical professionals, but they work in a non-healthcare setting. And then there's level 3, I think they're active license. They may not be working, but they're active. They might be retired, but the license is still active. And then level 4, it's people who have medical background, their license is not activated. So these are the different levels, but don't get hang on those levels. It's for us to determine. But once you're in level 3, just know that you're ready to be deployed.
Right. And the medical level, level 2, for example, it looks like, Jane was asking about, that would mean that you probably work in like a healthcare clinic, but you're not necessarily in a healthcare, you're not necessarily working in a hospital. So we just like to determine that just based on, there may be a specific need for someone who has hospitalist privileges, for example. So, we make sure to stratify that out so that we can alert appropriately. So that's where those levels kind of come into play. So with that being said, we're kind of reaching the top of the hour, so I want to be respectful of everyone's time. Thank you so much for everyone coming in today and taking time out of your Saturday. We so appreciate your time today and for your interest and hopefully for your availability to serve. I do just want to quickly point out that sometimes there may be, it may be difficult to make it in. We have nearly 30,000 people now that are assisting us as volunteers. The good thing is sometimes based on the amount of vaccine, there may be maybe too many people trying to get in to help, but that's a good thing. And we need you to still help us, because as we said, this is going to be a long journey, and we will also hopefully be getting more and more vaccine in the coming months. So that will mean that there's more and more availability to help. So that being said, if you can't get in the first time, still keep trying. And we so appreciate your time, your enthusiasm, and your willingness to serve.
Yeah, thank you so much for everyone. We really appreciate you. You all rock. Thank you. And I send the emails. I send the 2 emails that if you have any question about general question or question about COVID-19, I put that in the chat as well.
Awesome. Well, with that, we'll go ahead and end today's meeting. Thank you so much, everyone.
Thank you. Thank you all.